ever, your hard work and dedication to the community is appreciated. Thank you for your selflessness and for protecting our community by working on the front lines of the virus, helping individuals stay safe and healthy, and for continuing to share information on COVID-19 to flatten the curve. Please know that we are working every day to make sure you have the tools and resources you need to continue to serve the residents of our county. With continued teamwork, we will get through this and we will come out better and stronger on the other side. Moving on from here, as you know, on April 2nd, I received a joint letter from our hospital CEOs requesting that the county assist with standing up a mass care facility with 3,000 beds. The request was based on modeling and data analytics on that date. As you know, the data is revised regularly to ensure we are responding to the most recent conditions here in Mecklenburg County. Since Friday, conditions have changed in some very important ways. First, both our hospital systems have done extraordinary work maximizing the infrastructure within their walls to create additional hospital bed capacity. This additional capacity slightly mitigates the need for additional beds. Second, we have been informed by FEMA and state emergency management that there is no assistance forthcoming to help with staffing, equipment, or supplies for a mass care facility. The federal government is prioritizing how supplies are distributed across the country, and North Carolina is not at the top of that list. So all of the supply and staffing needs would need to be satisfied locally. Finally, it appears that the social distancing taking place to date in the county has begun to flatten the curve slightly. That does not mean we are out of the woods yet. But based on those factors, Atrium and Novant have revised their requests and are asking that we build out a 600-bed field hospital in or near Uptown to provide additional capacity and facilitate the transfer and care of patients close to their primary hospitals. The need for 600 beds as opposed to 3,000 beds assumes that the stay-at-home order remain in place, that it is aggressively enforced, and that is not lifted prematurely. I want to repeat what I just said. Now more than ever, we need every resident in Mecklenburg County to comply with the stay-at-home order. The best possible outcome is that we build 600 beds and not a single bed is used. In terms of next steps, the request for this mass care facility has been sent to the State Department of Emergency Management. The Army Corps of Engineers has begun evaluating locations that might meet the criteria and will make a recommendation as to which is best suited for this purpose. The Army Corps of Engineers will build out the facility, and emergency management and the two hospitals will do the sourcing needed to equip the facility. In addition, we will launch a campaign to encourage healthcare workers across the region to work with our hospital systems to staff the facility. If anyone is watching who is interested in helping, I am asking that they go to the North Carolina Terms website, which is terms.ncem.org. I'm going to say that one more time. It is terms.ncem.org. The acronym stands for Training Exercise Response Management System. There you can register and enter your credentials, and they'll be vetted by the state, and they'll get back to you to see if you qualify to participate. We are working closely with CMPD and the town police departments to aggressively enforce the order. We continue to get requests from various businesses requesting clarity on the order to determine if they can operate. Tyrone Wade, our county attorney, has been evaluating these requests and providing that clarity. As you know, I negotiated revised business processes with auto dealerships and realtors to allow them the ability to do business on a limited basis. We recently learned that the State Department of Revenue has been issuing letters to businesses in our county providing exemptions from the order. I have contacted the governor's office requesting that letters not be issued to businesses in Mecklenburg County, since our order is more restrictive than the governor's. That same request was made by our Emergency Management Office to State Emergency Management. I have also requested assistance from the North Carolina Association of County Commissioners for assistance on this issue. Some counties in the state have implemented waiver processes to allow businesses to apply for an exception to the order. Based on the case count and epidemiology in Mecklenburg County, we will not be implementing a similar process. We will be expanding enforcement activity in our parks and in our greenways. We will be closing park gates to reduce the number of destination visitors to our larger parks and greenways. Park rangers and additional staff will have to man most of the larger park facilities, which could be as many as 60 locations. The parks will turn into walk-in amenities only. Park and Recreation will work with CMPD for additional barricades to block entrances to the parks and work in partnership for enforcement of parking on city streets near park entrances. Any cars that park in front of gate areas will be towed automatically. Park and Recreation will work with additional law enforcement agencies to assist with non-compliant parking in the towns. We will also use the resources of the Sheriff's Office to provide additional law enforcement support. These actions are the final step before we take aggressive action to close our parks and greenways. I hope that these measures will allow residents to use our facilities, practice social distancing, and stay safe. Mecklenburg County stay-at-home order expires on April 16, 2020. We are working on revising the order to align with the governor's order, which expires on April 29, 2020. All other aspects of our order should remain the same. Again, if we continue to aggressively enforce the existing order and every resident in the county stays home and practices social distancing, no additional restrictions should be needed. At last night's City Council strategy session, the city discussed providing additional funding to the Men's Shelter of Charlotte and the Salvation Army Center of Hope. The city is considering using federal HUD dollars to support 50 families identified by the Salvation Army and 70 individuals identified by the Men's Shelter. This will create additional capacity at both shelters, allowing the shelters to serve more medically fragile, unsheltered individuals and families. The proposed funding is expected to be presented for approval at the City Council meeting on Monday, April 13th. As you know, you approved an emergency leave policy for county employees. The emergency leave ensures that county employees that are unable to telework will continue to get paid. The 80 hours that was originally granted is about to expire. I will be extending that emergency leave for another 2 weeks to continue continuity of pay for all county employees. My commitment has been and continues to be that all county employees will continue to get paid during the pandemic. In addition, we are aggressively evaluating all the changes at the federal level related to FMLA and pension changes and implementing them accordingly. And with that, I will turn it over to Gibby to provide her update. Thank you.
Good evening, Commissioner Dunlap, Chair Dunlap, Commissioners, and Manager Diorio. I wanted to give you a brief update on where we are with the situation in the county right now. To date, as of 4:30 this afternoon, we've had 805 laboratory confirmed cases in Mecklenburg County. There have been a total of 8 deaths. And those range in the age from 60 to 93, all had underlying health conditions. We've had lots of questions about testing. In our community, we continue to test those who are most at risk, and especially where testing would make us respond differently. And those situations typically include individuals who are ill enough to be hospitalized, as well as our healthcare workers and first responders. We're continuing to ask people if they have mild symptoms to stay at home and consider the fact that they have COVID-19 and self-isolate for the time frame that they need to until their symptoms are gone for at least 3 days. We also ask them to consider those that they may have exposed and work to alert those individuals, since we will not be doing any contact tracing with those cases. You received data yesterday, updates from our data in the community, and I'm just going to speak to a few of those. This is specifically for data as of April 4th. We had 605 cases at that point that were reported in county residents in Mecklenburg County. These only reflect laboratory confirmed cases. We want to remind people that there are many individuals in our community who are infected with COVID-19 who have not been tested because they are asymptomatic or do not meet the current CDC recommendations for testing. So the numbers that you see only reflect a snapshot in our community, do not reflect the true burden of COVID-19 in our community. The other thing I will point out, and I'll continue to point out, is that our numbers may differ from what you will see in the state and federal counts. All of the cases that are tested in Mecklenburg County, regardless of whether they reside in Mecklenburg County, come to us and are reported directly to the state as well. We evaluate those test results as they come in and make sure that we are only reporting Mecklenburg County residents. So the data that you see in the reports that we put out are specifically Mecklenburg County residents. Highlights from the 650 reported cases: about 3 in 4 reported cases were adults between the ages of 20 and 59. We had 11 cases in youth under 20 years old. Younger adults make up most cases for all racial ethnic groups, except non-Hispanic Blacks. I know this has concerned a lot of individuals in our community. What we are seeing is about 1/3 of the cases in non-Hispanic Blacks are in individuals over the age of 60, and only 1/4 were in the youngest age. So it's the complete reverse of what we're seeing in other populations. I want to point out too that more of our deaths disproportionately are found in African American community. They are among elderly with underlying health conditions. At this time, we do not believe the racial ethnic differences observed in our data are related to the spread of COVID-19 or differences in the susceptibility of certain groups to being infected by COVID-19. We do think these differences are more likely related to our current testing criteria, which is focused on symptomatic patients and those with underlying racial ethnic disparities and rates of chronic conditions that increase the severity of illness with COVID-19. I don't know if any of you heard the points that were made by our U.S. Surgeon General today that actually shows that this is playing out across the country. What this does for us is emphasize the need for good access to testing in the county for those who need it, and also making sure that people know when to seek care and testing, regardless of the population. About 1 in 5 cases, reported cases overall, were hospitalized due to their COVID-19 infection. However, the hospitalization rates among older adults, those over the age of 60, were significantly higher, and are 1 in 2 of those individuals were hospitalized. We've had 8 deaths due to COVID-19, as I mentioned earlier. 40% of reported cases have been released from isolation. That means that they have met the CDC criteria and are considered no longer infectious. There were reported cases of COVID-19 throughout our entire community. You can see that on the map that was released yesterday. We are seeing widespread infection and just continued confirmation that we have community spread in Mecklenburg County. We have designed a COVID-19 awareness and social distancing campaign after reviewing the data to make sure that we are providing information specifically to those who are either potentially more impacted by this infection, as well as those who have the potential of spreading it more readily. This includes our younger adults and our non-Hispanic Blacks 60 years and older. We plan to communicate this proactively in a culturally competent manner, and we are currently seeing in the COVID-19 cases. Our marketing efforts will include a combination of paid ads and posts, as well as grassroots efforts within the community. We will target these types of activities to the particular populations. So we're looking at 4 weeks of combined radio ads and social media posts with those 30 social media influencers made up of college students, local radio personalities, and local celebrities. That will create over 300 posts. There will also be at least 400 radio commercials on urban radio, gospel, Spanish, and early market stations with endorsements from radio talent. We're also looking at grassroots marketing campaigns, amplifying the awareness messages, and we've identified potential partners, including many faith groups and others who work directly with the African American over age 60 group. These partners will share printed materials and information. We're working with Novant Health. Dr. Jerome Williams has offered to leverage his team's community engagement outreach to help us with this population. And we recognize the need to deliver accurate, trusted, culturally competent information through the lens of health equity. I want to reemphasize what the manager said about the stay-at-home order. We are seeing some slight evidence that the order is having the desired effect in our community. And I do believe that the continuation of this order is critical to our being able to, number one, reduce the number of cases as well as the deaths, but also to manage what we are seeing in our hospital systems. I left you with a quote the last time I spoke with you, and I'll do that again tonight. If we view ourselves as besieged victims who need to go into hiding, then we will cultivate fear and hoarding. If we view ourselves as a community working hard to protect the most vulnerable among us, then we will cultivate courage and helping. Mindset matters. I really encourage everyone in our community to be part of the solution and to stay at home. Thank you.
Mr. Chairman, that it concludes our presentations. As I indicated, we have representatives from the hospital systems here to answer questions. And so myself and Gibby, as well as our hospital representatives, are prepared to answer any questions the board may have at this time.
Okay, so let me tell you how I want to proceed with this, because I know there are a lot